Thank you very much, Bill. Now we go to John.
Well, first off, thank you, and it's a privilege and honor to be. And I'm a huge believer in actually what Bill just said, is that in some sense industry has got to take a step up to actually provide more leadership and not wait for Congress and whoever, any state governments, to actually tell us what to do. So my issue is around laboratory results and providing it to patients directly, which is a hugely controversial issue on transparency. So just by way of background, I'm the Chief Medical Officer of Quest Diagnostics. Quest performs 550,000 laboratory tests every single night. We send those results to 150,000 physicians, fully 1/5 of all the doctors in the country, every single night, either electronically or by fax. We don't send, up till now, about actually a month ago, any of those results to patients. And we don't know if the physicians actually transmit or communicate those results to their patients, and if that happens, when it happens. We do know that if we detect an abnormal result, we go out of our way to do everything possible to make sure that that physician knows that result. But I can tell you right now that upwards of 7% of every single abnormal diagnostic result never gets communicated to a patient. And I'm talking really abnormal results. Think about that. Providing results to patients, we believe, reduces the risk. It will reduce the risk of results never been acted upon. We think it'll increase dialogue between physicians and patients. It'll educate patients. And also, importantly, it'll reduce the duplication. 14 to 15% of every laboratory result in this country is duplicated because the patient or the physician doesn't get the result and doesn't know how to act on it. Most importantly, it will better enable patients to manage their health. Think about it. If you had your laboratory results, what you would do with that result. You'd look it up on the internet, you go to social networking sites, you'd begin to engage a little bit more in what your healthcare means to you. In fact, last year, we actually had 1 million people call us so that we could directly send them, either by mail or fax, their results directly, because they were beginning to get engaged. We believe, obviously, that not all results need to go to patients directly. HIV screening results, genetic tests, and cancer diagnosis, we believe, still should go to physicians first, as terms of those outliers. We've had a lot of argument and discussion around this and controversy. Physicians will argue that patients don't have the necessary background or knowledge to make interpretation of those results. Well, think about it. Who are we as physicians to be that paternalistic to tell the patients what they should or shouldn't know? We believe by empowering patients, they would be much further engaged in their health care. Some will argue that it altered the doctor-physician relationship. We believe it'll probably improve it. We know that Kaiser has sent out millions and millions of results to patients over the last 5 years, and it has fully engaged many of their patients to a much more significant degree. So Quest made the decision within the last year and several months ago, as the first diagnostic company, to actually provide patients with their results directly in 33 states in this country where we can actually do it. It turns out that in 17 states or so, it is against the law. Think about it. It is against the law in 17 states for us to provide the results to patients. That's their results. It has to go to a physician first. We did it through a new mobile platform. We launched a personal health record on a mobile platform, both iPhone and BlackBerry, and actually Android within the last couple of weeks. So with a personal health record, if you sign up, patients can get their laboratory results directly downloaded into their smartphone. And you can have those results and then call your physician about it. We did build in a 48-hour delay. So in other words, the results goes to the physician, and the physician has 48 hours before we release those results to patients directly. All right? 48 hours, and then we release them on the mobile platform. Again, it does not include HIV, genetic tests, or cancer diagnosis. So the reason I want to talk about this today is because it is all about transparency. And is there an inherent conflict with physicians and their own patients? Does there really exist a conflict that physicians think still that they may know best for their patients, which we believe they do, given the results? But is it right, or is it the time now so that we begin to provide those kind of results to patients, so that patients can be more fully engaged in the healthcare system? So we believe that disclosure and transparency is here and now. And we've made that huge leap, quite honestly, to begin to move forward in a much more transparent, patient-centric system. So I look forward to hopefully hearing from some of the physicians in the audience to get some further feedback about whether or not they believe this is the right way to go. Thank you.
Thank you very much, John.